2 minutes to talk. Okay, thank you so much for letting me present this. When I asked some colleagues about this presentation, they said this is the first time we hear about it. So I wish you will have a very, trip with me on this journey that I will do and talk about it. So, okay. There's no conflict of interest, and the objective is to review the need of blood donation, to overlook the effect of donors' mood in first and recurrent donations, and to review psychology theories used to explain donor behavior, and to describe how blood collection establishment can utilize present psychology knowledge about blood donors. So we will acknowledge mens sanguine and ISBT as well. So the first question, why we need blood? Simple answer. Can you save lives? Everybody, when you ask them why we donate blood, it's to save a life. But when you will ask this question to different locations of that person, for example, me, if you ask me as a donor, I will be, to save life. But if you ask me as a medical director in the blood bank, what is my answer will be? To fill my inventory, to keep my inventory healthy. But if I am the physician that's treating the patient, why I need the blood? You will be surprised for the answer. So, for staff in blood bank mainly is to keep the inventory adequate level of blood products. For staff at the hospital mainly is to cover the symptoms of the patient so he will discharge very fast and get another new one. This is true, by the way. It's not a joke. This is what most of the doctors, the physicians, they do that. So they can bring one after one after one. But for blood donors is merely to save life. So this is what they call it, a cartoon that they do. It's like Starbucks or Dunkin' Donut or everything for a drive-through or McDonald's. But in the old ages, in Saudi Arabia, it's like this. You will put your arm and somebody in the other side will collect the blood without seeing you. So this happened before. So when I saw that, it's looked like he came in the back direction. So we will talk about to become a donor is a choice, right? I want to be a donor is a choice, except if you be forced to donate. But if you are a voluntary donation, it's my choice to do and give the blood. Every donation is a choice as well. So I donate blood, whole blood. Then I came, they told me to donate platelets. I said, no, I want whole blood. So the choices is maybe it will change. Maybe, yes, I will donate blood, platelets this time, but maybe next time I will donate whole blood. So every donation is a choice. For blood donor management, it is important to know which factors influence these choices. This is what we need to know about the psychology of the donors so we can recruit him to come and donate again and again and again. There is no replacement of the need of voluntary blood donors. However, there is still blood banks force the patient to do so. We agree about that. Yes. So here we are going with the WHO to reach the 100%. Qasim, they reached 100% voluntary donation. But still in Riyadh, we have about 60% voluntary donation, but there's still 40% is for replacement. Recruitment and retention of blood donors requires some understanding of human motivation and factors affecting their decision to perform an action. So if the donors come and you did something wrong to them or something that he may harm his feelings, he will not come back to you. So why a person donate? In general, not for blood, for anything. Donating is from a pro-social behavior. It's like the father and the mother or your culture that raise you to be a giver, to give people. So sometimes it will be growing with you since you are a kid. It's a free gift as well. It's not you pay for it. To donate means to give. However, no donor can be characterized by complete disinterested altruism. Anybody can explain this, what they call it? This is from the lesson 1971. He said about that. It's that no donor can be characterized by complete disinterested altruism, because there's another people, they don't donate to be altruism. Maybe they become self-efficient. Maybe they want to be egoism. So we will talk about that in the next slides. So what is the meaning of altruism? Anybody can give me altruism? What's the meaning of it? بالعربي. إيثار. يؤثر نفسه للناس. So he wants to help the people. So maybe it is that, but not all the what they call it. Most of the donors are altruism, but primary reason by donors themselves. So some of the donors, they said I want to help them. However, altruism in relation to donating blood is not disconnected between donors and non-donors. Altruism is not related to donation frequency as well. So it's not only donation blood, giving donation. So it is another things that you can do with that. Egoism. What's the meaning of egoism? Ego. شوفة النفس, or I can't do it. So some people, they give blood because, look, I am giving blood. So this is mainly with whom? Which gender? With male. With male, that they can give blood. Altruism is more with the females, they found. But with the egoism, it's with the male, that they want to show that they are strong, they can give. So there's a reciprocal ability, helping me, helping you. Some people, they need to do health screen. Some feeling like a hero, I am a hero, or feeling proud. So all these things that it will reflect the egoism with the donation. What about the benevolence? What is the meaning of it? Who said إحسان? أسمعت واحد يقول إحسان. Yes, that's right. So he feels sorry for those patients that need blood. I want to give them. So this is one of the effects of the donors. Donating blood is not pure altruism. It's not, so they feel like, oh, this patient, they need this blood, I want to give him. Like if you see, what do you call it, an ad or something that I need blood for my wife or my kid. So this is what we will do. This is what you are thinking about. So both donor and recipient profit. So the patient will be proud. The donor will be proud, and the patient will be safe. So critical balance, giving and receiving. So it will be like, if you give, you will receive. Some people, they think, if I give, I will receive. This is some of the thinking people that, what they call it, there's a book, it was in the early 20s, called The Secret, if anybody read it, called The Secret. It's talk about that. If you give, you will receive. So some people will believe on that. So it will be the giving and receiving, it will be in balance. So factor influencing the balance. There's a factors that this balance of this donor, if you touch them with those factors, he affect if he will donate or not. So what are they? Negative donation experience, like physical or psychological, temporal deferral, and organizational factors. So I will talk all of these three factors that how it will affect psychologically to the donor itself. So this will affect where it will be affecting. So negative donation experience, like what? He donates sometimes and he faint. He said, I will not donate at all again because he fainted. So he will be scared. He will not do it again. So those are what happened to the patient or the donors during donation. So for vasovagal reactions like sweating, nausea, hypotension, syncope, so the incidence is less than 1%. For needle site reaction, like bruises, stiffness, hematomas, the incidence rate is less than 30%. And non-risk factor, young age, first-time donor status females also are factors that affect the donation. For what I said, females are more prone to donate more than men. Okay, so physical adverse reaction in experienced donors. Does an adverse reaction increase stopping risk experienced donors? Which will stop the donation again if we have it? What about sex difference? As I mentioned, females are less. They will come to donate. So there was a study from Sinquin mentioned that in 12,051 whole blood donors, and reporting for adverse reaction, that the question that what happened to them, and did they come within 2 years or not, and separate analysis for men and women. So this is the first thing that happened for the men and women. For the needle reaction, so about 1% on men is less. So the women reaction for the needle is more than the men, and even the vasovagal reactions. So men are lower odds on reporting the needle reaction and vasovagal reaction, and increase in age, lower odds on needle reaction and vasovagal reaction. This is about the sex is a female and women and men as well. And here as well for the same thing. So if you see here for the women that the needle is 1.3% that they didn't come back, and for vasovagal attack, 1.78%, they didn't come back to donate. And if you see the difference that the men, they didn't come. The women came back more. So if you see for the vasovagal attack is 3.95. So women are more, altruism to give blood for the patient. So to summarize, vasovagal reaction negatively affects stopping risk. It affects being donors as well. Strong sex difference. Women experience more adverse reaction than men. And stubborn risk is men twice as high as in women. So the women will come back, but the men, they will not. So the implication, coping with adverse reaction, also important for experienced donors. So men cope differently with the women. So did anybody attend donation and see what happened if the vasovagal attack to a man or a woman? The man, he will be in over all of the place when he have a vasovagal attack, but not like the woman. The woman, she will just faint. This a big difference. So you will see it, like he wants to fight, not like the woman. Yes. So factor influence the balance. So we talked about the negative donation experience, temporal deferral, and organizing factors. So negative donation experience will affect that the donor will not come. So negative donation experience, psychological donation reaction, fear of needle, or even blood. So if he see blood, he will not come to donate. He said, I am afraid of blood. To see it, I will faint. Or he is afraid of needle prick. So he will not come as well. Fear of negative reactions, that he saw it in front of him once, that somebody had rigors or something, that epilepsy, or he was vomiting, or dizziness, or faint. Fear of getting infection. Did you hear that? One of them is my friend. When I asked him why you don't donate blood, he said, you may give me an infection. I said, why? Because you are testing for HIV and HCV, so sometimes it's the information that they have, it's wrong. But it's in his mind, it's working that will give him an infection. So it will not give him an infection, so that's a false, formation. Not feeling up to it. He said, can you donate today? Today I'm tired. I don't feel that. I don't want to go. Maybe after 10 million years to donate. So sometimes they don't want. They don't have the passion to donate. Feeling tense, that he doesn't want what will happen to his blood. Is he will have any reaction during the donation or not. Watching other donation faint, domino effect. So if one fainted, so everybody will faint like him. That's why we have curtains. So anybody faint, we have to close it with the curtains to save him. So temporary deferral, being deferred more important than deferral type. So if you defer him, it's more important what you deferred him for. Like, for example, some people, you defer him for taking antibiotics, so for 7 days. So this may affect that he will not come back. But some people that we have HPV, that he will not donate at all. But sometimes the temporary deferral will affect that the donor will not come. Even short-term deferrals are determinable. So, what about organization factor? Organization factor.
Sorry, Dr. Abdulmajid.
Yes.
2 minutes.
Okay. So this is the last factor that I am talking about is, for example, staff attitude that we have. This is the problem, the main problem in most of the blood banks in here. So when the donor comes, I want to donate, he will not look at his face. Give me your ID. What do you want to donate? Blood, whole blood, or apheresis? Even he doesn't contact his eye. So, and sometimes when he see, why you are coming late, come tomorrow. We will close after 30 minutes. So that will affect the donation, the donor himself, that he will not come back. Waiting times, that the phlebotomist sit in the coffee break or coffee room and the donor is waiting to donate. Parking space, you don't have parking, so he will not come because he will not have a parking for his car. Invitation policy, so when he come, that like routine, your appointment is at 1 o'clock p.m. When he comes, he will find a lot of people. And he said, I have an appointment. He said, no, you will be on the line. So he will not come back again. Pressure to donate, that's again what the replacement donation. Donation center locations, if it is in the hospital or it is outside the hospital. Some people, they said, I will not go to the hospital. I may get an infection from there because there's diseased people. So, negative donation, terminal deferral, and organization factor. So we talked about all these. It will affect so for attitude, the theory is better research. The attitude like donating blood is useful. Self-efficacy, I feel capable to donate. Moral norm, like I feel responsible to donate. Or subjective norm, others are important to me, thinking that I should donate for them. So all these 4 will go to the intention. And the intention will become as a behavior for the donation. So this is the main picture on this lecture, that how to make the donor to behave as a regular donor. So this is the time course. So I want to show you that most of the people who donate, they will be in the waiting area. 70% are happy, prenatal, nervous, and donating, happy 15%, and refreshment area, they are happy. They only in the prenatal, they are nervous because they are afraid of the needle prick. So, so those are what they will feel. We talked about it. So the retention, convenience, opening hours, that it will be for example, if you open it from 4 p.m. to 12 a.m., that's a very convenience for worker people because they will not work at that time. Inform donors about side effects, provide care and aftercare, especially with vasovagal reaction. When defer, provide care as well. Contact donor after deferral period. And use the need of recognition always. This is a very, very important. Even deferred donors need to be recognized. Regardless of their number of donation made, all donors need to feel capable, provide reassurance. So this is the study in short. So thank you so much.